There were many medical advances during the Industrial Revolution. One of these advances was the smallpox vaccine. In 1796, Edward Jenner, the founding father of immunology, developed vaccines for smallpox. This smallpox vaccination was made mandatory throughout Britain. In 1800, René Laennec, a famous French physician, invents a stethoscope, allowing doctors to listen to their patients' hearts.
In 1818, British obstetrician James Blundell performs the first successful transfusion of human blood, which opened a whole new field of medical potential. In 1842, hospital care began improving. American surgeon Crawford Long uses ether as an anesthetic during surgery but does not publish his results. In 1839, Edwin Chadwick insisted that diseases were because of a lack of sanitation in Britain, so he improved sanitary conditions and public health. One of the reasons why Chadwick believed in improvements to public health was because he believed it would save money. By 1848, the House of Lords had approved his proposal for a hydraulic system in Chicago that would wash out waste. This led to the publication of the Public Health Act, making the government responsible for public health conditions and allowing cleaning of trash locally without permission from the government. In 1849, Elizabeth Blackwell becomes the first woman doctor to receive a medical degree, paving the way for many other women doctors.
In the 1860s, more and more doctors began fighting for improvements in sanitation in hospitals. In 1867, Joseph Lister publishes the Antiseptic Principle of Practice of Surgery, one of the most important books in medicine. Lister was convinced of the needs for cleanliness in the operating room, a revolutionary idea at the time. He develops antiseptic surgical methods and begins using carbolic acid to clean wounds and surgical instruments. The immediate success of his methods leads to the general adoption.
According to germ theory, a theory developed by Louis Pasteur and Robert Koch, a specific disease is caused by a specific organism. Because of this discovery, they were able to develop vaccines against rabies and anthrax in 1881 and 1882. Additionally, they developed a system for pasteurizing milk, which was able to kill off harmful microbes in the milk. In 1890, Emil von Behring discovers antitoxins and uses them to develop tetanus and diphtheria vaccines. In 1895, German physicist Wilhelm Conrad Röntgen discovers X-rays, allowing for examination of wounds and bone breaks. Almroth Wright invented the first successful vaccine for typhoid fever in 1896. It was a potentially deadly disease, and if left untreated, it could result in death. This invention saved thousands of lives. In 1897, Ronald Ross, a British officer in the Indian Medical Service, demonstrates that malaria parasites are transmitted via mosquitoes, although French Army surgeon Charles-Louis Alphonse Leveron identified parasites in the blood of a malaria patient in 1880. The treatment of malaria was identified much earlier and is still used today.
Waldemar Hofkeen invented and tested the first bubonic plague vaccination. Finally, in 1899, Felix Hoffmann revolutionized pain medication, developing aspirin by synthesizing acetylsalicylic acid. In conclusion, the Industrial Revolution vastly improved sanitation, and vaccines and inventions are what helped shape the medical world we live in today.